Telemedicine. Definition of telemedicine. Telemedicine refers to the use of electronic communications and information technology to provide clinical healthcare services remotely. This can include consultations, diagnostics, treatment, and patient monitoring. Telemedicine leverages tools like video conferencing, smartphones apps, and other digital platforms to connect healthcare providers and patients who are geographically separated. Overview of telemedicine. Telemedicine has evolved significantly, driven by advancements in technology and the need for accessible healthcare. Its applications span various medical disciplines, from primary care to specialized fields such as dermatology, psychiatry, and cardiology. Key features. Number 1. Real-time communication. Enables live consultations via video or phone calls. Number 2. Asynchronous communication. Allows patients to send messages, images, or test results for later review by a healthcare provider. Number 3. Remote monitoring. Utilizes devices to track patients' health metrics, such as blood pressure or glucose levels, and transmit the data to providers. Evolution of telemedicine in healthcare. Telemedicine has undergone a remarkable transformation, evolving from simple remote communication to a sophisticated and integral part of modern healthcare systems. Below is an outline of its key milestones and trends. Number 1. Early beginnings, pre-20th century. Primitive forms of remote care. The earliest concept of telemedicine involved using messengers, letters, or telegraphs to communicate medical advice. Use of telegraphs and telephones. The advent of telecommunication allowed doctors to consult with patients or other physicians over long distances. Number 2. The 20th century, 1930s to 1950s. Radio communication. Introduced for remote medical advice, particularly for sailors or individuals in isolated areas. Military and NASA applications. During World War II and the space race, telemedicine was utilized to monitor astronauts and soldiers in remote locations, 1960s to 1970s. Telemedicine pilot projects. The Massachusetts General Hospital, MGH, developed a system to provide remote medical consultations to patients at Logan Airport. Teleradiology was introduced, allowing X-ray images to be transmitted between healthcare facilities. Federal support. The U.S. government funded programs to explore telemedicine's use in rural areas. 1980s to 1990s. Advancements in technology. Development of personal computers, satellites, and early internet technologies enhanced telemedicine capabilities. Specialty-specific telemedicine. Disciplines such as dermatology, psychiatry, and cardiology began leveraging telemedicine for remote diagnosis and management. Number 3. The digital era. 2000s to the present. 2000s. Broadband internet. Widespread access to high-speed internet enabled real-time video consultations and high-quality data sharing. Integration into healthcare systems. Telemedicine began to complement traditional care models, particularly in rural healthcare delivery. 2010s. Mobile and cloud technologies. Smartphone apps and wearable devices allowed remote patient monitoring, as heart rate and blood sugar. Cloud platforms enable secure storage and retrieval of medical records. Regularity support. Governments and institutions developed frameworks for reimbursement and licensure to encourage telemedicine adoption. COVID-19 pandemic 2020 accelerated adoption. Telemedicine became critical as physical distancing measures limited in-person visits. Global expansion. Virtual healthcare services surged worldwide, driven by necessity and regulatory flexibility. Diverse applications. Rapid growth in telehealth for primary care, mental health, and chronic disease management. Number 4. Current trends and future directions. Artificial intelligence, AI, integration. AI-powered tools for diagnostics, predictive analytics, and decision support are enhancing telemedicine services. Wearable and IoT devices. Continuous patient monitoring through wearable sensors as smartwatches, glucose monitors, and Internet of Things IoT devices. Global health initiatives. Leveraging telemedicine to address healthcare disparities in low-resource settings. Advanced interoperability. Seamless data exchange between telemedicine platforms and electronic health records (EHR). Hybrid care models, combining in-person care with telemedicine to create a more flexible and efficient healthcare delivery system. The evolution of telemedicine demonstrates its role in making healthcare more accessible, efficient, and patient-centered. As technology advances, its potential to reshape global healthcare continues to grow. Current trends and global perspectives on telemedicine. Current trends in telemedicine. Telemedicine is rapidly evolving, incorporating cutting-edge technologies and adapting to shifting healthcare demands. Key trends include: Number 1. Artificial intelligence and machine learning. Enhanced diagnostics. AI-powered tools assist in analyzing medical imaging, predicting patient outcomes, and diagnosing diseases. Chatbots and virtual assistants. AI-driven systems provide basic consultations, symptom checkers, and follow-ups. Number 2. Remote patient monitoring (RPM). Devices like smartwatches, blood pressure cuffs, and glucose monitors continuously collect health data, enabling real-time monitoring of chronic conditions. RPM improves outcomes by allowing early intervention based on trends detected remotely. Number 3. Wearable technologies and Internet of Medical Things (IoT) devices seamlessly integrate wearable sensors with telemedicine platforms for data exchange and remote consultations. Examples include ECG monitors, fitness trackers, and smart inhalers. Number 4. Interoperability and integration. Systems are increasingly designed to integrate telemedicine platforms with electronic health records (EHR), ensuring seamless data flow. Interoperability improves continuity of care and facilitates multi-provider collaboration. Number 5. Hybrid care models. Combines in-person visits with telemedicine to deliver flexible, comprehensive care. Patients receive remote consultations for follow-ups while attending physical appointments for critical procedures. Number 6. Expansion of telebehavioral health. Increased adoption of telemedicine for mental health services addressing global mental health crisis. Telepsychiatry and counseling platforms have become crucial for reaching underserved populations. Number 7. Regulatory and reimbursement frameworks. Many countries are formalizing regulations for licensure, reimbursement, and privacy. Telemedicine services are increasingly covered by insurers, incentivizing widespread adoption. Number 8. Localized solutions for emerging markets. In low-resource settings, mobile-based telemedicine is bridging the gap in healthcare access. Initiatives focus on low-cost platforms and training local providers in telemedicine tools. Global perspectives on telemedicine. Developed countries. United States. Telemedicine industry has expanded significantly with Medicare and private insurers support services. Policies like HIPAA ensure privacy compliance. Europe. Nations like Sweden and the UK have integrated telemedicine into national health systems. The EU emphasizes cross-border interoperability and patient data security. Japan and South Korea. These countries focus on integrating telemedicine into aging population care and chronic disease management. Emerging economies. India. The government supports telemedicine through initiatives like eSanjeevani, providing free consultations to millions. Africa. Countries such as Kenya and Nigeria leverage mobile platforms for rural healthcare delivery, overcoming infrastructure challenges. Latin America. Brazil and Mexico are leading telemedicine adoption with programs targeting urban and remote populations. Global organizations and initiatives. WHO promotes telemedicine for universal health coverage, emphasizing accessibility and equity. Global telehealth networks foster collaboration among nations to share expertise and scale telemedicine solutions. Cross-border care. Telemedicine facilitates access to specialized care in different regions, addressing workforce shortages. Conclusion. Telemedicine is reshaping healthcare delivery worldwide, driven by technology, regulatory support, and patient demand. While its adoption varies globally, telemedicine holds immense potential to address healthcare disparities, improve efficiency, and enhance patient outcomes. Its future lies in continued innovation and collaboration across sectors. Applications of telemedicine in healthcare settings. Telemedicine is a versatile tool that integrates seamlessly into the three tiers of healthcare: primary, secondary, and tertiary care. Each level benefits uniquely from telemedicine technologies, improving access, efficiency, and patient outcomes. Number 1. Telemedicine in primary care. Primary care focuses on preventing care, health education, and the management of common illnesses. Applications: virtual consultations, remote assessment of common conditions like colds, flu, or minor infections via video or phone. Chronic disease management. Telemedicine platforms monitor conditions such as diabetes or hypertension with regular data transmission from patients. Preventive care. Health promotion through online consultations, lifestyle coaching, and remote screening. Pediatric care. Remote consultations for minor illnesses in children, reducing unnecessary clinic visits. Medication management. E-prescriptions and medication adherence monitoring via applications. Benefits: increases healthcare access in rural or underserved areas, reduces unnecessary in-person visits, saving time and costs for patients and providers. Number 2. Telemedicine in secondary care. Secondary care involves specialist consultations and interventions, often through referrals. Applications: specialist consultations, remote consultations with cardiologists, dermatologists, or endocrinologists using high-resolution imaging and shared medical records. Teleradiology, transmission of X-rays, CT scans, and MRIs for remote interpretation by radiologists. Telepsychiatry, virtual sessions with psychiatrists for mental health assessments and therapy. Post-surgical follow-ups, monitoring recovery and addressing concerns without requiring physical visits. Diabetes and cardiac care, regular telemedicine check-ins with specialists to adjust treatment plans. Benefits: reduces the burden on tertiary care facilities by addressing specialized needs remotely, ensures timely interventions and continuity of care through seamless communication. Number 3. Telemedicine and tertiary care. Tertiary care involves advanced and specialized medical services, including surgeries and critical care. Applications: tele-ICU, remote monitoring of critical care units, allowing specialists to oversee patient condition in real time using IoT and AI-driven platforms. Second opinions, enables consultations with top specialists worldwide, often critical for complex cases like cancer or rare diseases. Telesurgery, assist in remote surgical procedures using robotic systems and live video feeds. As Da Vinci Surgical System. Rehabilitation services, post-operative physical therapy sessions conducted via telemedicine platforms. Transplant and oncology care, long-term follow-up care for transplant recipients and cancer patients through virtual visits. Benefits: enhances access to advanced care in remote regions through expertise sharing, supports healthcare providers with real-time guidance in complex procedures. Telemedicine in chronic disease management and emergency care. Telemedicine plays a transformative role in both chronic disease management and emergency care, offering tailored solutions that enhance patient outcomes and optimize healthcare delivery. Number 1. Telemedicine in chronic disease management. Chronic diseases such as diabetes, hypertension, heart disease, and asthma require continuous monitoring and long-term care. Telemedicine provides tools for proactive and patient-centered management. Applications. Number 1. Remote monitoring. Devices like blood glucose monitors, digital blood pressure cuffs, and wearable ECG devices track patients' data in real time. Data is transmitted to healthcare providers for analysis and timely interventions. Number 2. Teleconsultations. Regular follow-ups are conducted virtually, reducing the need for frequent clinic visits. Patients receive medication adjustments and lifestyle counseling without leaving home. Number 3. Patient education and support. Applications and online platforms provide educational resources about disease management. Virtual support groups foster community and improve adherence to treatment. Number 4. Predictive analytics. AI-powered tools analyze patient data to predict exacerbation and recommend preventive actions. Benefits: improved compliance. Patients are more likely to adhere to treatment plans with regular virtual check-ins. Early intervention. Remote monitoring identifies complications early, reducing hospitalizations. Cost efficiency. Minimizes travel costs and decreases the financial burden of hospital stays. Number 2. Telemedicine in emergency care. Telemedicine significantly enhances the speed and quality of care during medical emergencies by facilitating remote assessment and timely decision-making. Applications. Number 1. Teletriage. Patients are evaluated remotely to determine the urgency of care. reduces overcrowding in emergency departments by directing non-critical cases to appropriate care settings. Number 2. Pre-hospital care. Emergency medical personnel use telemedicine to consult with physicians while en route to the hospital. Enables guidance on administering life-saving treatments like CPR or stroke management. Number 3. Stroke care. Telestroke programs. Neurologists assess suspected stroke patients remotely, enabling rapid administration of clot-busting drugs, TPA. Number 4. Trauma management. Trauma teams provide remote support to healthcare providers in rural or resource-limited settings. Video consultations guide stabilization efforts before patient transfer. Number 5. Disaster response. Telemedicine supports healthcare delivery during natural disasters or pandemics where in-person care may be limited. Number 6. Mental health crisis. Telepsychiatry services offer immediate counseling and intervention during mental health emergencies. Benefits. Faster response times. Telemedicine connects patients to specialists without delays, critical in emergencies like strokes or heart attacks. Accessibility. Bridges gaps in emergency care for remote or underserved areas. Continuity of care. Provides a seamless transition from emergency stabilization to follow-up care. Real-life case studies. Telemedicine success stories. Number 1. Chronic disease management. Diabetes care in India. India faces a high burden of diabetes, with millions in rural areas lacking access to endocrinologists and diabetes specialists. Implementation. Platform. A telemedicine program was developed to monitor patients' blood sugar levels using mobile-based glucometers. Process. Patients uploaded daily readings to a secure app. A remote care team of doctors and dietitians provided feedback and adjustments via video consultations. Results. Improved glycemic control. Patients experienced an average reduction in hemoglobin A1C levels by 1.5%. Increased compliance. 80% adherence to lifestyle recommendations due to continuous virtual support. Expanded reach. Over 500,000 rural patients gained access to specialist care. Number 2. Emergency stroke care. Telestroke program in the United States. Rural hospitals often lack on-site neurologists to assess and treat stroke patients, leading to delayed care. Implementation. Program. A network of rural hospitals connected to urban stroke centers via telestroke technology. Process. On suspicion of a stroke, rural doctors initiated a video consultation with a neurologist. The neurologist remotely reviewed CT scans and patient symptoms in real time, guiding the administration of tissue plasminogen activator (TPA). Results. Reduced treatment times. Average time to TPA administration decreased by 40 minutes. Improved outcomes. 25% more patients achieved full recovery compared to pre-telemedicine implementation. Cost effectiveness. Reduced unnecessary patient transfers to urban hospitals. Number 3. Remote patient monitoring. Heart failure care in Canada. Patients with heart failure require frequent follow-ups to prevent hospitalizations, but many live far from specialty clinics. Implementation. Program. A telemonitoring system for heart failure patients was introduced. Process. Patients used wearable devices to monitor vital signs such as blood pressure, heart rate, and weight. Data was sent to a centralized platform where nurses flagged abnormalities for cardiologists. Results: hospital readmissions reduced by 30%. Patient satisfaction increased to 95% due to convenience and reduced travel. Cost savings of CAD 1.2 million annually for the healthcare system. Number 4. Telepsychiatry. Mental health crisis intervention in Australia. Australia faces significant mental health disparities, particularly in remote indigenous communities. Implementation. Service. A 24/7 telepsychiatry hotline was launched, providing video counseling and crisis intervention. Process. Patients in crisis connected with psychiatrists via video. Therapists provided counseling, de-escalation techniques, and medication recommendations. Results. Suicide rates in serviced areas dropped by 20% over 2 years. 70% of patients avoided hospitalization after timely intervention. Community trust increased, with more individuals seeking help earlier. Legal and ethical considerations in telemedicine. Telemedicine offers significant benefits, but it also presents unique legal and ethical challenges that healthcare providers, organizations, and policymakers must address to ensure compliance, patient safety, and equitable care delivery. Number 1. Legal considerations. 1.1. Licensing and jurisdiction. Licensure requirements. Healthcare providers must be licensed in the state or country where the patient resides. Cross-border telemedicine services often require additional permissions or licenses. Telemedicine-specific regulations. Many regions have introduced telemedicine-specific laws, but inconsistencies remain between jurisdictions. 1.2. Data privacy and security. Patient confidentiality. Telemedicine platforms must comply with data protection laws, such as HIPAA in the USA or GDPR in the EU, or similar regulations in other countries.